Have you ever wondered how much it costs just to work as a doctor in Australia? I don't mean fancy conferences or equipment or anything like that. I mean just to walk in the door of the hospital and start doing your job. Well, let me give you a clue. I could be doing a yearly holiday to Europe for the amount that I spend just on being able to practice. Let me show you a breakdown of what I spent to be able to practice as a doctor in the past year. Hi, my name's Dr Freya Bleathman and I am a doctor in Melbourne, Australia. And I've been a doctor for
a few moments later.
7 years, and I've been working in paediatrics for 6 of those years, just to give a little bit of context for some of the fees that I'm talking about. So we'll start nice and gentle with my police check. $70. That's just to make sure I've not become a criminal since I got my last job at my last hospital the year before. In addition to a police check, I have to get someone to co-sign a stat deck to say that I've not murdered anyone in the past year. I'm not even kidding. But, well, or that I've murdered anyone ever, but you get the idea. $70 for a police check. And I get why they do that. Next, a little bit more, we've got my working with children check, which I have to get renewed every few years because I see paediatric patients. If you've got any chance that you'll see a paediatric patient, you have to have a working with children check, and that's $100. Now, inching up a little bit more, we've got my indemnity insurance. So this is the insurance I get to help cover me personally against any litigation or problems to just protect me in my clinical work. The hospital also has insurance that covers you, but it's really wise to get your own because you've got to protect yourself above all things. Now, because I'm still a doctor in training, I only pay $150 a year. Once I become a consultant, that'll skyrocket and I'll be paying thousands of dollars a year. And it depends a little bit on what subspecialty you do. Certain higher risk specialties with lots of procedures and things like that pay much higher insurance premiums. But for now, I'm saving a little bit on that. Next, we've got my AHPRA registration. So this is the fee to stay on the National Health Practitioner Registry. You need to be on that to be able to practice. Basically, the big kind of boss and overseer of most health professionals in Australia, not just doctors. And that costs me $1,027 per year. Next, we've got my AMA membership, so the Australian Medical Association. And technically this one's not essential, but I do find it really important. And the AMA basically helps support doctors, helps advocate for them, helps settle pay disputes, give legal advice, kind of you name it. They can be really helpful with those things. And they also help kind of bargain for us with the new enterprise business agreements every few years. So that's basically improving our working conditions and our pay and how many shifts we can legally be made to do in a row or how many hours we can do in a 24-hour period, that kind of thing. And that one is just over $1,000. It's $1,047 a year. And then finally, I've got my college fees. So I'm part of the Royal Australian College of Physicians, and I started paying my fees for this college as soon as I joined paediatric training, and I'll continue to pay it as long as I practice as a paediatrician. And that sets me back $3,700 a year. The $3,700 is just the annual membership fee. It doesn't include any of the exam fees or anything that you have to pay on top of that. So yeah, over $7,000 per year just to cover my basic requirements to be able to practice safely and legally as a doctor in Australia. So if you're a med student or a junior doctor, definitely start to budget for these things because it adds up pretty quickly. And if you're not in medicine, then I hope this was interesting. I think a lot of people don't realize that we actually pay quite a lot to be able to work, and obviously it's worth it, but it is, it's a huge expense. And that's not even including how much I spent on sitting my specialty exams a couple of years ago. And if you're interested, let me know and I can make a video on that too, because it was a lot more in addition to this $7,000 odd that I would have spent that year too. So subscribe for more insight into the behind the scenes of working as a doctor in Australia.